Medicaid covers nearly 90 million Americans, but coverage doesn't always equal health. What if the real driver of outcomes isn't the doctor's office or even an app, but the community itself? Welcome to CareTalk Executive Features, a series where we spotlight innovative companies and leaders working to advance the healthcare field. I'm David Williams, president of Health Business Group, and my guest today is Darin Buxbaum. He's co-founder and CEO of WiderCircle, a nationwide community-powered platform that partners with health plans to engage hard-to-reach members through peer-led circles and technology tools. Darin, welcome to CareTalk.
Thanks so much for having me on, David. It's truly an honor.
You know, WiderCircle is such an interesting organization. Just as I look at the website, and I'm wondering, you know, what kind of inspired you, maybe through your own experience, to start something like this?
Yeah, no, thanks for asking. And I've been in healthcare for decades now. This is my third company, and what really inspired this one was a family experience. Unfortunately, after my grandfather's passing, my grandmother, who made the best chicken cutlets in the world, she just lost her connection with this world. And nothing we did as a family, we moved her closer, eventually into a great assisted living facility. She never reconnected, and her health just spiraled precipitously. I just wish I knew back then what I understand now, which is how critical connection are for our health, for our happiness. And that's what's really inspired WiderCircle.
You know, it sounds right. And it sounds like even if you didn't know exactly what was going on, you could see that there was like an impetus for it, right? She was okay, cooking, doing everything. And then all of a sudden something changed and she wasn't. And she's not the only one like that, clearly.
Clearly, no, loneliness is an epidemic in this country. And the Surgeon General has recognized that. But I'll tell you what we've kind of understood is that loneliness, that scourge, really eradicates hope. And that's what, if I look at both in healthcare and just society at large, hope is that key ingredient that's missing from too many of our lives right now.
So when you were starting up this company, did you identify the gap like that? Like, we're going to close the hope gap, or what usually, you identify some sort of an opportunity, something to differentiate on. What was that at the time of the founding?
Yeah, at the time of the founding, it really was around loneliness. Like, we saw that people were just lacking that social connection and purpose in their lives. And that evolved to trust. When you have these groups, what we found was that, wow, and these are peer-led groups. These are like in real life. And what we found is people trust neighbors. They don't always trust their health plans, but they do trust their neighbors. And so we saw this massive trust chasm in healthcare that was being bridged by these peer-led support groups.
I mean, how do you spark up something like that? I mean, on the one hand, I can understand that. Yeah, I trust my peer, I don't trust my health plan. But like with a health plan, at least they can hire a bunch of people, put them in a call center, connect them. And it's like, oh yeah, I'm going to have peers. Well, they may be doing something else. And if you start off being lonely, I mean, where do you find these peers in the first place?
Yeah, well, we started the company inside of a senior center. Actually, it was a living lab, and we saw how does this work. And I'll tell you, a lot of senior centers, it's very much like high school, being in a cafeteria. People have their places. Can you be part of the clique, the group, the not? And what we spent a lot of time researching the psychology of belonging. And so we started in Medicare, and then we've really branched into Medicaid in a massive way, because we were able to say what enables people to feel like they belong. And we have incredible community engagement leads that we have on the ground in these communities. We use a lot of data to kind of parse through and understand who should be in these groups. Think about it like an eHarmony matching algorithm for these groups. But then you have the spark. That's the incredible part of being human. Once you get people together, they can't help themselves but connect. And we have incredible stories about groups that you would never imagine connecting, finding belonging, in these groups.
Nice. So I love the idea of how it started off in the senior center, and I can imagine managing one high school group and all that. And it's kind of exciting. But now you mentioned Medicare and then Medicaid. And so I think when you talk about sort of scaling up and going beyond like a club model or something, but to actually making it, sustainable and as a business, you've got to find the payer somewhere. So how does Medicare and maybe more importantly, Medicaid come into it?
Absolutely. When we got started, a lot of my co-founder and I, we'd raised $250 million in the past. And people who have backed us said exactly what you're saying, David. They're like, how how does this model scale? We're talking humans, not tech, just pure tech. How does that work? And we're doing this now across 15 states. Uh, and the way that it really scales, I'd say, is what we do is we ignite the community, but people are just there are people who can't help themselves, but help other people in this world. And we call them ambassadors. And those people in the group become the connective tissue that keeps that group together and then allows us to keep scaling more and more and more groups in the community. Um, our transition into Medicaid, I'll tell you, was not an easy one because we actually rolled out in Detroit, Michigan, at just pretty much one of the peaks of COVID, and said, "Hey, come on out, trust us." And when I've learned about health plans, I thought about renaming us to St. Jude. They never give us the easy cases. They want us to reach the hardest to engage members. And so there we were, knocking on doors, meeting people. That's the spark. But once it ignites, the community takes on a life of its own.
Nice. Well, I think it would be typical, right, to say, when you're starting something up, people, even if you've had a track record before, people are like, nah, I don't know. But it's like, here's this group that they've totally written off. And it's like, give that one a try and see how
Yeah.
it goes. And then, of course, if you can do it, then, because then they don't have any expectations and you can actually exceed that. And they say, wow. And then you can go from there.
Yeah, absolutely. And that's kind of where we've gone. Think about it. What we realize is we've created this community engine and we've closed that trust chasm. So now whatever a person needs to do to take better care of themselves, they can. And they're getting the support of their community through that. So whether it's what's the popular things, it's closing gaps in care. It's making sure that people can get through redetermination processes, that they can sign up for important programs like SSI and get all of the benefits that truly that are coming to them and they deserve. Um, but these are things that are just, quite frankly, creating that safety net so that they can have a healthy life. And then, honestly, they're really seeking financial independence. That's what we're seeing in our groups right now. The hope that they want to aspire to, the hope that they have is, I can get to a financially stable place in life and not even need to be on Medicaid anymore.
Got it. And so you're dealing with a Medicaid population, and some are probably
Mhm.
dual eligible with Medicaid and Medicare. Is Medicaid itself a source of revenue for your activities?
Yeah. So the model that we have works with Medicaid managed care organizations. And through those organizations, they sponsor our community groups. And look, this is where Kumbaya meets calculators. You come to the group, you get a hug, you feel great. And let's be real, like health plans have a fiduciary responsibility. Claims are the source of truth. And so what we've done over time, we've brought in the top actuarial firm in the country. We've done multiple peer-reviewed published studies. We have shown that these communities lower hospitalizations, they close the care gaps, they retain members and have a positive impact on the bottom line.
Nice. So they could say, "Yeah, was that hug worth $50? Okay, yeah, 58.72. We'll sign up for another one."
We are still working with the actuary. I like what you're saying. We're working with the actuaries on the value of a hug,
Yeah.
but they leave the hugs to us, and then we just share the numbers with them.
So let's move out of the financial and actuarial realm for a second, and a little bit more. I'd like to hear about how a peer-led circle actually works. I get it. You got certain individuals; they want to be helpful. It's kind of the nature of people to get together. But give me a sense of what would a peer-led circle be like if I were enrolled in one?
Yeah, absolutely. So first, we're inviting you to out into your community. Sometimes there'll be a community center, a park, a local business. We love to support local businesses, and honestly, at the first time, we may just break bread together. And you're coming and understanding like things that you can learn to get ahead in life. So especially for our Medicaid population, there are a lot of folks that they just had their electricity turned off, or like they're going through these different crises, and they can come together and kind of get support in that group setting and learn from tips and tricks. And when they figured it out, here's the thing that people don't understand about healthcare and about life in general, but healthcare, it's emotional. So once they figure it out, now they're coming to the group and sharing that knowledge. So you come, now the first time you come, it feels like perfect strangers. But by the time you come a few weeks in a row, you're like, wait a second, like these are now my friends. You start building this bond of belonging. And we do these in maternity support groups. We do this across all ages, and that's what we see in common is once you have co-design and co-experience, that is a critical part of being human is just having that sense of belonging.
And how does some of the kind of local communities differ from one another? I understand that there's the commonalities. You mentioned I think you're in 15 states. I saw Baltimore and Baton Rouge. Both are places that you've been. Can you share a little bit of local flavor from those are two different places, both starting with BA, but
Yeah, and then the similarities end about there. Just massive differences in digital literacy, massive differences in many ways. What I would say, like what we see in Baltimore, for example, we run these great maternity support circles, and in those groups, and this is a sad thing, but people do not. This is a amazing, amazing life journey people are on, and they're not getting the support at home to as they're going through their pregnancy, and they don't even know which prenatal care visits they should be doing. They have lots of beliefs, even like they deliver the baby, like what's the right way to sleep on the front, on the back. I mean, there are some really base critical needs that they're able to share with each other. So we kind of see communities there in Baton Rouge. I'll tell you, like an incredible event that we just did was an expungement fair. Have you ever been to an expungement fair, David? Yeah, like I had never been to an expungement. No, okay. So we won't talk about maybe your record or things you've done in the past, but these individuals, like in Baton Rouge, you can't even get a job in fast food in some fast food chains if you have something on your criminal record. And this was a mistake that they may have made decades ago, in their like teens. And so they're coming out and they're getting some support and help and figuring out how do you wipe that record clean so that you can actually move ahead and, get yourself ahead. So each community, different need being solved. But I'd say all being united because like back to Baltimore, in one of the groups, we have the moms like write a letter to their unborn child and saying, what do they want? And so many of the moms say, I want to provide for them and give them a stable life that I never had. I want to make sure that, they can get ahead. Maybe they can go to college. That's a dream we all have. That's a shared like a shared experience of wanting it to be better for our kids.
So a lot of this has been focused on the very, human experience and with a little detour into the actuarial side of things. But what
Sure.
role does technology play? Because there's got to be some role. I assume it has to do with, amplifying the human connection. But where does, you're not Luddites, I assume.
We are not Luddites. Like I live in Silicon Valley. You know, AI is going to forever change our society. We use technology kind of in two places, but it's really to scale and give time for people to build these relationships. So on the front end, we do data science and analytics like any value-based care provider and understand what are the modifiable utilization patterns. Like what are members, by the way, what are matching algorithms so that, David, you may be the paragon of health, the archetype, the thing that everyone wants to follow. Well, who are other people you could connect with, and you can kind of help them find the path that you did. We also are using technology to just honestly facilitate getting stuff done. So we have an AI, like we use an LLM in order to help people locate and solve their social determinants of health needs, but at a very community-based level. So that's not something that you necessarily like need someone holding your hand through entirely. If you're like, no, I need a place. Where can I get food today? Like, where can I get some help with housing assistance? Great. That's a great thing to have a personal assistant in your pocket. And so we're finding technology really is able to scale solving the social determinants of health.
So in terms of measuring the results, you were talking before, we'll go back to the actuarial side for a moment and understanding kind of like
Sure.
the net impact. But what are the sort of the drivers of it? We could talk about, I can just hear from some of the things you were saying, like with the maternity group, like if you don't know what prenatal visits you're supposed to have, then assuming the prenatal visits are actually, useful, if you can go to more of those, that's better. The baby's supposed to sleep on his back instead of the front, then that is good
You're
for
good,
producing
David. We're going to have
SIDS.
you in.
Yeah, yeah. Well, I
That's
have
right.
four kids, so we know about that one. But are
Congrats.
there specific things that you kind of look at beyond just to say, hey, this should work? People get together. It's nice. They'll share views, and then it'll be successful. Or are there like particular areas like do you keep somebody in the managed care plan longer? Do you prevent them from going to the ER? Like, are there certain things like that?
Yeah, and that's exactly it, David. And, the hardest part, there's the dreaded A word in healthcare, and that's attribution. Like, how do you connect a hug to someone not going to the ER? And what we found is we get people on these journeys, and we're able to first build trust. Like the first couple of months, we're just building trust in that relationship. And then we realize there are critical things for them to do for their health. So in our population, when you sum it all up, I'll say what you see in our populations is a concomitant rise in preventative care. People are going to see their PCPs more, so PCP visits per thousand increase. Like the preventative care gap closure increases. So you're seeing all the things like population health. They're supposed to happen. You're supposed to do. And then you see a reduction in urgent care, like ER utilization. And by the way, our groups talk about urgent care. And this is the funny thing, because every plan sent out hey, go to urgent care postcard. It's going to be better. But here's how peers talk about it. They're like, my son, played baseball, got this injury, and I always go to the ER, or like I don't even go see my PCP. I go to the ER. But you know what? It's not fun to go to the ER. The wait times are long, all these things. And another person in the group will be like, I went to this urgent care clinic. They saw me in 5 minutes. It was great. And the person's like, what? Really? And that's actually how we get people to modify site of care, change their behavior. They hear it from a peer. And then the end result, you lower ER. Guess what? You lower inpatient too. It just is like dominoes that fall.
That's good. So I think a lot of those factors are well understood by the plan. So if you said if we could have an impact on these topics, on these drivers, then they could see
Yep.
where it's going to go. So that makes sense. Now, what about so in addition to caring about cost, the plans also care about things that give them a reputation, and in some cases also additional payments. And I'm talking about things like star ratings, HEDIS scores. Do you also look at that impact, or is it more just from kind of like the individual level of claims?
No, we really look at this as on a population basis. So you kind of mentioned duals, Medicare. I would say the trends we saw last year was everyone wanted to get annual wellness visits. They wanted to make sure that there was accurate coding and all those things. We're seeing a very different tone and temperament this year. Now everyone is playing the stars game, and they're realizing we really need to boost quality. And so we are on a blitz right now where we're building these communities and closing colorectal cancer screening and making sure people get their blood pressure checked and past that. And so we're closing tremendous numbers of HEDIS gaps to ensure that plans can get those star ratings up.
Got it. Okay, because I know they care, about that. There's different angles to go at, and then it's interesting here. Like, what's the flavor of the year? I didn't know it was, uh, you know,
It's
col- colon cancer season, prevention
colorectal.
season. Yeah,
Yeah, that's right.
yeah, that's good. That's a good season. That's a healthy season. Now, you said something
That's
interesting.
it. It is.
there's an
Mm,
interesting thing I
please.
was attributed to you or to the company, and it's a thought I hadn't had before. So I want to see if I'm right and if you could explain it. So you talk about looking at Medicaid plans, looking at community as critical infrastructure. What, first of all, is that something that WiderCircle talks about? And what, if so, what does that mean?
So, David, let's take a step back. We live in a democracy. Community is critical infrastructure for society to work, and I think we're going to see that more and more writ large. And in healthcare, it's even more critical because, to your point, people are just trying to say, "Oh, let's rely on some call centers and other things." You know, it's one thing to send, it's message sent, but is message received? Is message heard? And where community comes in is when community sends that message, when it's your neighbor, when it's your friend. And let's be honest, we don't even all listen to our, like, my wife is going to watch this and I'm going to make an admission. Do I always follow all of her very sage wisdom? I mean, it's painful. She's always right. Not always, but like when my neighbor or my friend nudges me, I'm like, okay. I'm like, I realize that I need to, you know, actually take the next step, go to the gym, what it might be. That's where community becomes critical infrastructure. It's where messages get heard. I'll give a great example. We had a member who, in her own words, she was like, my costs were astronomical. I was visiting the ER like I was punching a ticket, like multiple times a month. And look, she had diabetes, and her doctor told her, "Look, it's time. Let's get you an insulin pump. You'll just do so much better." She just didn't trust him. She came to one of the groups, and lo and behold, someone in that group had an insulin pump, had a continuous glucose monitor, and an insulin pump. And she talked about it, and the person's like, "Yeah, this has been great." She's like, "All right, maybe this isn't going to be half bad." She got the CGM. She has not been back to the ER in a year. Her time in range is over 80%. But the reason why community is a critical infrastructure is because there are those members that you cannot engage, but just hearing it from a neighbor one time all of a sudden changed their entire behavior and saved a year worth of ER visits. That's why community is critical infrastructure.
So let's talk about accountability, which, if that's not the theme this year, probably be the theme next year. And in particular, I would like to get your view about who should be accountable for Medicaid outcomes. You've got these managed care organizations, you've got the states, you've got the providers, you've got the individual. How about the communities? I mean, where should the accountability
And
lie?
David, when everyone talks about accountability, what they're really talking about is dollars. Okay. And, I hear it and I get it. And I think what we're missing when we say the word accountability is, and what the healthcare really wants is healthcare wants individuals to be accountable for their health. Oh, I get that. Let's be real. A lot of healthcare would like the consumer, the patient, to be accountable for the dollars too. But at the end of the day, if they can be if they could be accountable for their health, if community and like really can, and I believe like lift up others, then let them be accountable and then let these other entities be responsible for covering some of the bills. I think we'd see a much different outcome, to your point, because it is about outcomes, if the community really was accountable. And for anybody who wants to just read something absolutely mind blowing, there's a book called Connected by Nicholas Christakis. They've published 6 New England Journal of Medicine papers on this, and what they found, by the way, is eerie. Like, you want to know if someone's going to quit smoking or not? Think about like things that healthcare cares about. Are you going to lose weight? Like, are you going to start exercising? Are you going to quit smoking? They wrote 6 New England Journals of Medicine papers, and what they found is, based on your neighbors, this was a retrospective analysis of the Framingham Heart Study, 80 years. Based on who your friends were, they could tell you, are you going to quit smoking? Are you going? It turns out we do not make these decisions ourselves. That's why community can be accountable. Like, because communities actually help us make these decisions.
So my final question I want to ask you relates to CMS priorities. In 2025, there's been an increased importance on aligning priorities with the executive branch of the federal government. And I wonder how, where CMS is now, how their priorities are aligning with what you're trying to do.
Yeah, look, uh, I was, chatting with some folks at HHS and CMS recently, and there is just a tidal wave coming. And that tidal wave is work requirements. So as much as I want to say SDOH and all these other, they are important, they are. But now is the time where we have to get ready for these work requirements because, close to 10 million individuals will likely lose coverage. And the vast majority of them, it'll be administrative reasons. Like you look at the unwinding, of the last couple of years, 70% of disenrollments were administrative. They were procedural disenrollments. And so now is the time for us to actually build trust in the communities because you can look at states who have had work requirements in the past and they sent all the messages out. This is again the message sent but not received. They sent all those messages out and people just didn't do it. And like there were states where the first month, 17,000 people lost coverage in a single state. So the critical piece now is building that trust over the next year, building up these communities. And believe me, these communities will help each other ensure that they can get through the work requirements gauntlet, help keep coverage. And we can't stop there. We have to do more. Coverage enables health stability, but that should build to financial stability. So that's where communities need to come together next. And I'd love to see CMS say, yep, look, we want people to graduate off of Medicaid. We want health to be the foundation. And then let's come together as communities to find better economic opportunities and help promote people off of Medicaid.
It sounds like it's going to be a whole new topic for a podcast in about 12 to 18 months. It's really pretty fundamental what you're just describing there. It's a totally different way to look at it than what I've seen.
Yeah, that is the power of community. It can actually take the problems that we all think are impossible. It could restore hope and improve outcomes, but improve life outcomes.
Well, that's it for yet another episode of CareTalk Executive Features. My guest today has been Darin Buxbaum. He's co-founder and CEO of WiderCircle. I'm David Williams, president of Health Business Group. If you like what you heard, please subscribe on your favorite podcast platform. Thank you, Darin.